Hi, good morning. Hello, hi, good afternoon. We will be starting our sessions within 5 minutes, waiting for others to join. So we'll be starting within 5 minutes. Thank you. Yes, hi, good afternoon. So we will be sharing today we'll be talking on OET writing. So we thought of taking this lectures because we have received many requests from students to take on online YouTube live sessions on writing, especially because the reason is like most of the candidates find it difficult, like when they come in terms of writing things, they find it difficult, like what information you need to pick up, what informations need to be tackled, and the information which is given to you on your question paper. So we thought of like sharing these small piece of informations on writing and recording the stuff and give the benefit to you so that you guys can go through it and that can help you with your writing. So I'll just share my screen with you so you guys can see the screen. So we'll be discussing about the letters in OET writing. So I'll just keep my caps lock on so that you guys can read it very clear. So we will be discussing about OET writing, in which the first thing which we need to understand the timing. The timing which is allotted to you is total 45 minutes. That is the time which is allotted to you. The total time given to you to complete this task is 45 minutes. Now, in this 45 minutes, it is divided into further two parts. That is the initial 5 minutes and the remaining 40 minutes. Now, in this 5 minutes, the initial 5 minutes which is given to you, you will have to make sure this time you utilize well to read the question paper very well. So at this point of time, you will be reading the question paper well. You will not do anything. They will not allow you to even touch your pen. So you just need to read the question clearly. You just need to understand the question very clear. You need to understand which all type of informations you need to pick from this particular case note which is given to you. Then you have 40 minutes. In this 40 minutes, you will be able to, or you should be able to write a letter with a body length of approximate minimum body length of approximate minimum 180 words to maximum of to max of 200 words. It should not be more than 200 words. So please make sure this is being taken care. Okay, just give me a minute. Let me just give me a minute. Okay, so we'll just continue. So I was discussing this. So writing letter 40 minutes, write a letter with a body length 180 words to max of 200 words. Nothing more than that. So your word count should be maximum 200 words, not more than that. Okay. Now let's understand what are the types of letter in this particular task. There are actually four types of letter which has been asked in OET for nurses, specifically for nurses. First one is a discharge letter. Then you have something called as transfer letter. Then you have something called as referral letter. And the last one is an advice letter. Now, advice letter is no more asked. Like we from previous many exams, we have seen that they don't ask advice letter. So we have always seen that the types of letter which is being sent or which has been given to the candidates are discharge, transfer, and referral letter. So we need to understand like what structure we exactly require when we write these kind of letters. Because see, in the assessment part, I'll give one thing very clear. When they do your writing assessment, initially, when an examiner looks into your paper, not more than 25 lines are assessed. When I mean it, they really don't check with your complete paper what have you written. But in certain cases, if they don't find enough lexical resources are not there, and they find that lexical resources which has been implemented in the letter is not up to the mark, they will look into the complete paper. They'll see like how well your language is. On that basis, your assessments will be done. So you'll have to make sure that your introduction paragraph and your second paragraph need to have good content in it. Okay, and I mean it. So understand your first paragraph and your second paragraph is the most important paragraph, and your fourth paragraph. Okay, that is something which is more important because that requires more of content, that requires more content to be it, and it should be arranged well, and it should be organized well. Okay, so now what we'll be seeing now is, let's understand what is the structure of the letter. Let me just see if anyone has any question related to this, so that they can put. If anyone has any questions, they can definitely put into the comment box on our YouTube page, and that can be accessed, and I can reply to you. That can be done. No problem with that. Okay, just a minute. Okay, no problem. Now, let's understand the structure. Structure for letter writing. Now, there is a particular structure for discharge and transfer letter, and there's a slight change in the referral letter. So about the referral letter, I'll take it in the next class, but today let's learn about discharge or transfer letter. Now, let's understand what need to be done when you write a discharge or transfer letter. Let's understand that. Now, the structure of the letter, the first thing what you need to write on your paper. Now, before that, let me also clarify one more thing. Your complete letter will be left aligned. Understand this very clear, which means whatever you write it on the paper, it will be on the left side of the paper you'll be writing it. Like for example, the name, the address, the reference, even your closing will be on the left hand side. Only the paragraph will run across the page, the rest everything will be on the left hand side. So keep this in mind very clear. Okay. Now the first thing what you write it on the letter, in certain case notes, in certain situations, they give you your hospital name. For example, they give you are a nurse working at Blue Star Nursing Agency. So if there is a hospital name given to you, like in which hospital you're working, you will write your nursing home name first. So I'm taking an example, Blue Star Nursing Agency. First thing you will write this. Then you will leave. So thus you can write in bracket name of the hospital you're working in. Then you'll leave one line, then you'll write name of the person to whom you're writing, whom you are writing. This is the first. The second thing what you'll write, but you'll leave one line after you write your hospital name of the person to whom you're writing. Then you will write designation of the person to whom you're writing, designation of the person to whom you are writing. Then comes your address. And when you write your address, you don't require any punctuations. So no punctuations required in address. Only at the end, when you finish your address, you'll just put a full stop. So no punctuations in the address part. So you can see it over here, these three things: name of the person to whom you're writing, designation of the person to whom you're writing, and the address of the person to whom you're writing need to be together. Don't leave any line, because understand those are human evaluators who are sitting on the other end to correct your papers. So those people will be looking into your presentation skills as well, because that makes up the mind. That really gives us a feeling that if the presentation skill is good, we get a feeling that okay, this candidate is good. So we already, that examiner has a positive impact about you. So it's better always keep a good presentation skills. Then after address, you will go and write the date. And the format of the date should be, see, whenever you write a date in an OET paper, your date will always be today's date, which means whichever day you're writing your exam, that date will be implied there, unless it is mentioned in the question paper that today's date is some other day. Otherwise, you will always, like, for example, today it's 9th April, so I'll just put 9 April. Your month will be in words and the year will be in numericals. 9 April 2018. Then I'll go to subject. The subject in OET is called as reference. So I will write REF, reference. And reference will always be, understand this, there is no diagnosis, nothing to be written in the subject. It will always be patient's name and age. That's all. Nothing else should be implied in the reference part. It should always be patient's name and age. Okay. Then comes your salutation. Now your salutation always starts with dear Mrs. like whatever, to whomever. If you're writing it to nurse, she's a fellow colleague. So no respected sir and madam is not required. You start with dear. Now, for example, I'm writing the person's name as, for example, see, I'm writing it to a charge nurse in a different nursing home. Her name, I'll take it as Susanna Matthews. So, for example, her name is Dear Susanna Matthews. I'll put a comma, then I'll start my paragraph from here. So please make it very clear that after you write your hospital name over here, you'll be writing the name of the person to whom you're writing, designation and the address. And after that, you leave one line, you write the date, which will always be today's date. Then you will have the reference, which will have patient's name and age. Then you'll have your salutation. Then you will start your paragraph. Now, the first paragraph which you write, the first para which you write, which is all about the overview of the patient. Now, overview means it should have, the first paragraph should have four informations. Now, those four informations include who the patient is, his diagnosis, his diagnosis, his current condition, and your purpose of writing. So in this paragraph, you will use all the three tenses, that is present tense, past tense, and all three tenses you will be using in this paragraph. Okay. So which will involve who the patient is, his diagnosis, his current condition, and your purpose of writing. Why you are writing this letter. These four informations need to be there in the first paragraph, which means you will be having four sentences in this paragraph. So keep this in mind, these four informations are required in the first paragraph. Then after paragraph, when you write your paragraph, you will leave one line. Okay, now understand this. Normally we have a habit, or like from the margin, when you write a paragraph from the margin, we leave 2 finger distance and then we start a new paragraph. But when you're writing an OET, to have a better presentation skills, don't leave that space. Better you start from the margin, and after every paragraph, leave one line. Your every paragraph will look well organized. Okay, so that is a good technique which you can use to improve your presentation skills. Now, second one is all about, second para is all about. Now, when you're writing a discharge letter, your second paragraph is something called as at the time of admission, when patient came to you. So it involves all the histories of the patient, all the history, which can be medical, from a social, or personal history. The history, whatever you feel about the patient, is important for the other nurse to know. You should involve all those data into this paragraph. It talks about the history of the patient. At the time of admission, when patient came to you, what was his situation? What was his condition? Was he able to walk? Was he conscious? Whatever the situation was at that point of time, at the time of admission, those informations need to be involved in the second paragraph. So which involves medical, social, and personal history, as well as the information about at present, currently, when the patient was there with you at that point of time, what was the patient's condition, that will be involved in the second paragraph. So I'll just erase this and I'll talk about the third paragraph. So let's see what all, now it is very clear. First paragraph is all about the overview of the patient, which involves who the patient is, what is the diagnosis, like what is the current situation and what is your purpose of your writing. Second paragraph involves about the information about the history of the patient, any medical, social, or personal history of the patient, or the situation when the patient arrived at your hospital. At that point of time, what was his condition? That will be involved in the second paragraph. Now let's see the third paragraph. Now third para involves all the details about during the stay of the hospital. During the stay of the hospital. Now, this involves all the details like post-admission. When the admission was done, patient came into your hospital. During the stay of the hospital, what all incidents took place? So, which may be any accidents which took place, like any fall during the stay of the hospital, any dietitian's input. Now, such as dietitian's input as such as, like you can say, weight loss or weight gain, any adverse drug reactions, any adverse drug reactions, his response to the treatment, This can also be called as the recent treatment and progress of the patient. Like recently, what all had happened with the patient during the stay of the hospital, all those informations need to be instilled into this paragraph. So any accidents, any dietitian's input, any weight loss, any weight gain, any adverse drug reactions happened, patient had any complaints which was severe, any resurgeries have been done, anything which happened during the stay of the hospital, all those informations you will involve in the third paragraph. Then comes your fourth para. Fourth paragraph is all about future follow-ups. It's pretty simple, guys. The same way you nurses go and give an over to other nurse, same way you need to write. That's all. Nothing else. Same way you just need to mention it over here. Now, when you write your fourth paragraph, you need to write about the future follow-ups, anything which you want in future the patient to be doing. So this paragraph is very important. This is called as discharge follow-up paragraph. Discharge follow-up. Now this involves about anything such as any future hospital visit, any future hospital visit, any blood test to be done in future, any blood test in future, any devices to be used in future, any devices to be used. Then you can say any doctor visit, anything whichever, like any medicines to be continued for future. So anything which you want to mention, like for example, see now the patient is getting discharged from the hospital. You speak to the relative or to the patient that these all medicines to be carried out. You need to take this medicine for another 6 days. You need to take this for another 10 days. So you give certain advices, right? You give certain advices on the diet, what kind of diet to be followed for coming days, all those informations which you want to give it for future, you'll involve everything in this paragraph. Now for example, if you're writing it to a nurse, for example you're writing it to a community nurse, so you will inform everything what all things need to be done for this patient in these coming days. So all those things, whatever you feel to be involved about the future follow-ups, you will involve it in the fourth paragraph. Then comes your last paragraph, that is fifth paragraph. This is nothing but this is called as an offer to answer question. An offer to answer question. Okay. An offer to answer question. An offer to answer question. So this is nothing but you'll just involve the data such as you'll just involve the response. If you need any further clarification, if you need any further clarification, please do not hesitate to contact me or my department. So this is the response which remains the same for any letter. So for fifth paragraph remains the same. It is not a paragraph exactly. It is just an offer to answer questions. And if you need any further clarification, please do not hesitate to contact me or my department. Then comes your closing. That also remains on your left-hand side. That is yours sincerely. Then again, leave one line. If there is a designation given to you, like for example, charge nurse, you will write that. But if there is no designation given to you, you will write it as nurse. Simple. Just write it as nurse. So it is that simple. Keep it as simple as possible. Now, one more thing which I want to write, whenever you write a letter, your every paragraph should have minimum 5 lines. So this is a line count which should be maintained. Every paragraph should have minimum 5 lines, and each line should have minimum 8 words. Minimum 8 words in the line. Okay. So this is what to be maintained to have a body length of 180 to 200 words. If this is not maintained, you may go like beyond 200 words or you may be below 180 words. So if you go above 200 words, to an extent they accept it, but if you come below 180 words, then that is a situation to worry. So you should make sure that every paragraph, whatever you write, it should have minimum 5 lines, and each line should have minimum 8 words written in a line. So you also can check, like when you write it on an A4 size paper, in a line, how many words you write. That is something which is more required when you write your writing. See, guys, now if you want to improve in your writing, you really need to write a lot. Okay, and make sure there is someone who is there with you who do your assessments, because assessments are really required. If you're preparing by your own, it's okay, it's completely fine, no problem, but assessments are equally important. Please understand this, because whatever you write, whatever mistakes you do, that need to be assessed properly, and proper guidance need to be given, because OET is an expensive affair. So make sure that you take appropriate guidance and then go for your exams. You can prepare it through YouTube, no problem. You can prepare it through lectures which are available widely on YouTube, but no problem. But whatever work you're doing, your work need to be assessed. That is something, please keep it in mind whenever you're preparing for your OET exams. So if you have any doubt whenever you're doing your writing, you're free to contact us, or our institute, that is British Academy, which is based all over India, like which we have more than 9 centers in India now. So you can contact any of our branches, or else you can also contact us. So tomorrow or day after tomorrow, I'll be taking another session on referral letters. So you guys can definitely join me on the structures of referral letters, and we can discuss the things like whichever you find it difficult. So you can also drop in a message in the comment box on our YouTube section, stating like what all things you want to know, or anything which you find it difficult in the OET exams, any modules which you find difficult. I can definitely be there to help you. So you don't forget, the company name is British Academy, Mumbai. So we have various branches in India, and you can also subscribe to our page on Facebook. That is British Academy Mumbai, British Academy Mumbai on Facebook. You can follow us over there, and please subscribe our channel on YouTube. Okay, so that once it has been subscribed, the next lecture, whenever I schedule, you will be able to get a notification on your mobile phone. Okay, that will be easy for you to access the website as well as to access the lectures whenever it has been conducted next this coming in a couple of days. So you can definitely follow that, and you can definitely subscribe to this channel, so there's every notifications whatever we have, because we also have an OET examiner in our team. Even she would be conducting lectures through this way, through this medium. So please make sure that you subscribe to our channel. So if you have any doubt or any queries which you want to ask, you can definitely message us on our messaging boxes, so that we can respond to you. If you want us to call you, just leave your number in our Dropbox. We will contact you back, and all your queries and questions will be solved. Okay. Thank you so much for your time and watching this particular channel. Have a beautiful day ahead. Thank you.